Hi everyone. In today's clip, I will talk a little bit about leaky gut syndrome. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health related matters, please consult your healthcare provider. Think of your gut lining as a velvet rope at an exclusive club. It lets the VIP nutrients stroll in, but keeps the rowdy toxins and microbes and half digested foods out. Leaky gut is the idea that the rope has worn out or wears out, and suddenly everyone gets in. So, scientifically, they call this issue intestinal permeability. The gut barrier is made up of cells that are joined by tight junctions. When disrupted, substances can pass into the bloodstream. So, as for the causes across science and alternative systems, the same villains keep showing up, such as biological triggers, chronic inflammation, gut infection, whether it is bacterial, viral, or yeast, dysbiosis or bad bacteria overgrowth, autoimmune disease, lifestyle triggers, ultra processed foods, high sugar and fat diets, alcohol, medications, especially antibiotics or NSAIDs. Chronic stress is a huge factor, environmental toxins, and weakened barrier. So symptoms tend to be non-specific, which of course causes confusion, but they range from bloating to gas, diarrhea, constipation, fatigue, brain fogs, food sensitivity, skin issues like eczema and acne, headaches, and more. The problem is that these symptoms overlap with dozens of other conditions, which is why diagnosis is very controversial. Diet modification and supporting gut microbiome with pro and prebiotics, plus vitamins like D3 and K2, L-glutamine are used to fix the cause and not just the lining. On the orthomolecular medicine side of views, we see the gut like a biochemical construction site. And the core idea is to restore optimal levels of molecules the body needs. And the common interventions are around L-glutamine, which fuels the intestinal cells, zinc, especially zinc carnosine, which supports barrier repair, omega-3 fatty acids, as an anti-inflammatory property because they have anti-inflammatory properties, vitamin A, D3, and K2 for immune and mucosal integrity, vitamin C and butyrate to fuel colon cells. The logic is that the gut wall is damaged and so it needs to be rebuilt with raw material. The leaky gut protocol has a full ritual, which is called the 5R protocol. The first R is remove, which is you're removing trigger foods and pathogens. The next is replace, and that's for digestive enzymes and stomach acid. Next one is re-inoculate with probiotics. Then it's repair, which is nutrients that is used to repair it, like L-glutamine, zinc, herbs, vitamin C, and so on. And then there's rebalance, which is for lowering the stress, maintaining proper sleep, and lifestyle. So there's remove, replace, re-inoculate, repair, and rebalance. And in the duration of this protocol, aside from the nutrients I mentioned earlier, we use bone broth, like for collagen and amino acids, herbal antimicrobials like oil of oregano or berberine, do elimination diets, such as getting rid of gluten, dairy, and sugar, and add fermented foods to the diet. So basically, we need to zoom out and treat the gut as a part of mind-body ecosystem. Gut is strongly tied to emotional stress, and nervous system dysregulation equals gut permeability. So the healing sort of requires first you do stress reduction, breath work, and then the detox practices sort of. In the old Eastern medicine, we viewed the body through humoral balance rather than microscopic barriers. The concept is that weak digestion leads to toxic residue, and improper digestion creates impure humors and these sort of circulate and cause systemic disease. In my previous clips, I have mentioned what humors are, but just as a reminder, we have 4 humors in the body. We have blood, which is warm and moist. We have yellow bile, which is warm and dry. We have black bile, which is cold and dry. And we have phlegm, which is cold and moist. These are also called temperaments. When any of these 4 is out of balance, we experience ailments. This very much resembles the modern medicine idea of endotoxins. Endotoxins are simply described as toxic substances released from inside bacteria and are associated with cell breakdown. So they're released mainly when bacteria multiply or die and break apart, at which point they trigger a very strong immune response. So weak digestive fire or low metabolic strength, overeating or incompatible foods, emotional disturbances, accumulation of waste are all strong players in leaky gut syndrome. And for this, we normally recommend the patient to go through a gentle detoxification, not aggressive purging, strengthen their digestion, and use warming herbs like ginger, cumin, and ensure to balance their diet by temperament or humors. In this method, we focus less on repairing a barrier and more on restoring harmony so the body repairs itself. No matter what method, whether modern, traditional, or alternative, we see major overlaps that they all sort of agree on. There is gut health is central to overall health, and stress plays a major role. Diet matters deeply, and microbiome balance is critical. So practical grounded healing strategy would include proper diagnosis, calming the inflammation through a whole food diet, reducing simple sugars, alcohol, and ultra-processed foods, supporting the immune system and microbiome through fiber, fermented foods, and probiotics, repairing and supporting by nutrients such as L-glutamine, zinc, and omega-3s, and nervous system regulation, which means stress reduction is not basically optional here. Emotionally and metaphysically speaking, leaky gut symbolically represents difficulty maintaining healthy boundaries, whether it is physical, emotional, or energetic, like taking on other people's emotions or energy, or difficulty saying no, or feeling overwhelmed by external influences. Also, unprocessed emotions or suppressed anger, grief, or fear, as well as difficulty processing life events, being always on guard or living in survival mode, feeling unsafe in life or environment, deep insecurity or instability, overextending yourself, internal conflict, weak sense of self, or over-identification with external validations are all part of this issue, basically. Truthfully, if you look at all this, it all goes back to creating stress hormone cortisol and also nervous system imbalance, as well as inflammation and gut-brain axis. So emotional and psychological states very much influence physical gut function through stress and immune pathways. Hope this has been helpful. My clips are also available on TikTok and YouTube. Like, share, and follow for more. Be the light.